So let's get to talk about the concept of what Amoeboma. I've told you guys that anytime you see oma added to any word, it simply means what you're dealing with a tumor, dealing with a tumor growth. Okay. So for Amoeboma is basically a tumor growth as a result of what Amoebiasis, an infection by what Entamoeba histolytica. All right. So get to talk about the definition. We'll talk about the diagnosis. We'll talk about the treatment. Of course, the causes. I've already spoken about the causes. The possible complications that could arise from an amoeboma. So amoeboma is actually a rare complication of intestinal amoebiasis. Okay, so it is characterized by formation of a tumor-like mass in the intestine. All right, typically this forms in the caecum or in the ascending colon, but it can actually form in any place though. We're just talking about a possible site for this. Okay, so it's actually caused by what the proliferation of what Entamoeba histolytica trophozoites. Those are the what existed type of what existed type of existed type of like when the Entamoeba histolytica goes into your system, it is inactive. When it goes out of the cyst, it becomes trophozoite. Okay, so when they proliferate, they invade the intestinal wall and form a granulomatous lesion. Okay, so what could be the clinical features for this? You go have things like abdominal pain, diarrhea or constipation, weight loss, fever, palpable abdominal mass, intestinal obstruction. All of this could actually what come from an amoeboma. Diagnosis, you can use things like colonoscopy, sigmoidoscopy, all right, since it is affecting more of the sigmoid colon and the ascending colon, all right. Then biopsy, that's where you are trying to find out for the presence of this Entamoeba histolytica. Then imaging studies like ultrasound, CT scan, MRI may show a mass. Serological studies may show a positive antibodies against what Entamoeba histolytica. So treatment is divided into medical treatment and surgical treatment. Medical treatment, you can use antiparasitic medications like what metronidazole, tinidazole. Then surgical treatment is when you are what surgically resecting the tumor out. Okay. So what are the complications? This could lead to what intestinal perforation, hemorrhage, and malignant transformation. Okay. So I think that's it for what tumor growth that could result as a result of what amoebiasis.